Okay, good afternoon, everyone. Welcome to the work session of the Las Cruces City Council. Today is Monday, February 13th, 2023. It's approximately 1 p.m. Before we begin, I'm going to ask if you please rise for the Pledge of Allegiance, but also for a brief moment of silence for a legendary lawmaker by the name of J. Paul Taylor, who passed away yesterday at the age of 102, as well as the 33,000 people who've lost their lives in the earthquake there in Turkey and Syria. Join me in the pledge, please. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, we're going to start off, as we always do, with our pets of the week. And Jennifer Martinez from our communications office will introduce one cat and one dog.
I am having difficulty sharing the screen, and I'm not sure exactly why, and I think it might have something to do with Zoom.
If you want to just read describe, right, what they look like,
Okay.
how much money they have.
Mayor and Council, I'm Jennifer Martinez with the city's communications office, and today I'd like to introduce you to Delilah. Delilah is a one-year-old short hair who is sleek, elegant, and overall the best kitty ever. I noticed that she looked black and golden, very, very cute. She loves to meow and tell you stories and ask you for love and pets. All she wants is a forever home with humans that she can love and cherish forever. She promises that she will be the sweetest companion that you could ever adopt. There we go. Let's see. Hooray. We get to see her. Okay. Of course, I finished reading about her, so I'm going to tell you now about Max, but then I'll come back. Okay, Max is a 3-year-old who is sweet and friendly and enjoys car rides and walks on the leash. He doesn't mind sleeping and crates overnight. However, he prefers not being kenneled or being contained for too long, as he is a bit of an escape artist. So his new family should stay with him on a leash outside until a yard is some sort of escape proof, if possible. You can meet these two by calling the Animal Service Center of the ASCMV at 382-0018. There is an adoption event going on this weekend. That's from 10 a.m. to 1 p.m. Saturday downtown at the Farmers Market. And there's also a Love is Forever adoption event that takes place through Saturday, the 18th, where all adoptions are discounted. The fees for fixed animals is $25, and if they are not, the fee is $50. And there's also a drive-through vaccination clinic that takes place from 9 a.m. to 2 p.m. that goes on this Sunday at the Field of Dreams. Thank you, Mayor.
Okay, thank you, Jennifer. Next is going to be Irene Pata from the Economic Development Department. Going to discuss the jobs of the week.
I'm not sure who was assisting in the viewing of this, these slides, but if they can assist me again for the jobs of the week, thank you. Somebody behind the scenes. Awesome. Thank you.
Okay, so you're not doing that. I thought, wow, you're pretty talented to talk and work on that while you're...
While they're loading that, Irene Bada with Economic Development. Good afternoon, everyone. Mayor, City Council. Okay. Oh, there we go. All right, so we begin with the City of Las Cruces, who is looking for an engineer. This position pays between $69,000 a year and $99,000 a year and is open until filled. White Sands Missile Range is also looking for an electronics engineer, and this position pays $52,000 a year and closes on February 17th. Quest Machine is looking for a packaging clerk. This position pays $12 an hour to $15 an hour, depending on experience, and closes on March 3rd. Angel Wings Home Care is looking for a caregiver. This position pays $12 an hour and closes on March 3rd. Sherwin-Williams is looking for a store associate. This position pays $13 an hour and closes on May 5th. And Pep Boys is looking for an auto mechanic. This position pays between $26,000 and $46,000 a year, depending on your experience, and closes on May 5th. Next slide. Am I needing to do that, or can they do that?
Whoever's doing this, next slide, please.
Thank you, Mayor.
Yeah. What's that person's name in The Wizard of Oz? The one who's back there. There they go.
Okay, great. The New Mexico Workforce Connection Office would also like to announce a rapid hire recruitment event this Thursday from 3 p.m. to 6 p.m., and these are the positions they are hoping to fill: apprenticeship employer representative, customer service associate, career consultants, business consultant, and a disabled veteran outreach program specialist. Last slide, please. And of course, for any questions, you can reach out to the local office at 575-524-6250 or at their office at 226 South Alameda Boulevard, and of course online at employeenm.com. Thank you.
Okay, great. Thank you, Irene. Okay, so next on, we have 2 items on the agenda. And the first one is going to be discussing pedestrian safety. Srijana and I guess some consultants are also, I guess that's the person who's on the Zoom, huh? Yeah, good.
Good afternoon, Mr. Mayor, City Council. My name is Srijana Basnet. I am the City Innovation Strategy Manager. Let's see. So while the PowerPoint loads up, in the spirit of comprehensive and strategic planning, I do want to just remind ourselves that roads are so much more than just a way to get from point A to point B. They are so critical. The entire transportation system is just a really comprehensive network and conduit to getting ourselves to places, but also creating places that we can have a great built environment that affects our public health. It actually contributes to economic and social mobility, economic development. And so it's a very complex system. And while today we're going to focus on one aspect of it, I just want all of us to be cognizant that there are so many pieces to this entire transportation system. Of course, with that, we are going to focus on pedestrian safety for today. All right, and then we do have our colleague over at Tool Design on standby today. Trung Vo will be presenting the content of this presentation. We've worked with Tool Design before on creating our active transportation plan, so they are very familiar with Las Cruces and some of the policies that we've been trying to implement through the years. We are going to talk about some best practices, but also some sound principles that we can bring into our design standards and the way that we build our streets. With that, we do have some short and mid and long-term countermeasures that can help us create more safe streets for our public. And then I'll go over a couple of next steps just to give you all an overview of where we are in the process of implementing some of these policy changes. So with that, I'm going to look to maybe Adrian to check if we can hand over to Trung. Trung, go ahead and unmute yourself, yeah. Oh.
All right. Well, thank you for having us as a part of this work session. Srijana, just checking really quickly, are you presenting slides on your end, and should I be able to see them from my end?
Trung, are you not able to see them?
I do not see them, no. And if we can't get those up, that's okay. I can just speak to the slides from what I see on my own desktop.
Hold on, we're gonna share a screen.
Okay.
And then I do believe, Adrian, if we can give Trung control so that he can advance the slides on his own, or should I do that? Okay, Trung, can you see it now?
I can, yes.
Okay, go ahead and just, you're gonna have to just tell me when you're ready, and then I'll advance the slides for you.
That sounds great. All right. Well, let's move on to the next slide. What we're going to cover in the next 20 to
Excuse me,
25 minutes or so.
Tron, I'm going to need you to state your name and the company you're with, please.
Of course, yes. My name is Trung Vo. I'm with a company called Tool Design. I am the office director for our office here in Denver. I'm a planner and engineer. I've been working in this multimodal transportation space for over a decade now, and it's really personal to me as a father, as a husband, as someone that cares about humanity and the planning and design of our street network. This is really important to me. So thank you for the opportunity to dive into what this looks like in Las Cruces. So before we jump in, I want to just explain that we made some observations and want to explore what existing conditions are like for pedestrian safety in Las Cruces, and then what it could be, or maybe even what it should be in Las Cruces moving into the future. So let's move on to the next slide. On the next slide here, just some really quick stats about the number of people that are killed on our roadways. It should be a very sobering number, right? It's not just 9 people, it's not just a number, but these were people with families and lives. So from 2011 to 2020, we saw that on average there were 9 people that were killed in roadway crashes across Las Cruces every year on average. So that's all modes. That's not just pedestrian fatalities. We'll get into that in a second. Out of those 9 people, about 3 or so, 2 to 3 were pedestrians. And so pedestrian safety is a really big priority for the city of Las Cruces, and it should be something that we're trying to tackle with everything that we've got. So moving on to the next slide, I want to compare New Mexico and Las Cruces to the rest of the United States. You might have heard of an annual report by Smart Growth America called Dangerous by Design. Unfortunately for 2022, New Mexico topped the list. Of all 50 states, New Mexico was the most dangerous state for pedestrians. The 3.76 number is the number of pedestrian fatalities per 100,000 people. So it's a per capita number. Las Cruces, comparatively, is right below that. And then you can see that the national average is 1.91 pedestrian fatalities per year per 100,000 people. The next 2 states on the list are Florida and then South Carolina, and those numbers are 3.22 and then 3.19. So New Mexico is by far the most dangerous place for pedestrians. And we're seeing that in recent years, there have been more pedestrian fatalities than in the previous 5 years. And so when we're looking at 2011 to 2015, those pedestrian fatality rates were not great either. But then from 2016 to 2020, they've been meaningfully higher. Moving on to the next slide, safety is a community goal, right? It's a priority for us. We state it as a clearly defined goal in our active transportation plan, in the comprehensive plan, and other planning efforts and design efforts as well. And it's not just traffic safety and saving lives, but there's also the benefit of roadway safety contributing to economic development and sustainability. So safety is a priority, but this is in tension with the reality of safety on our streets. So next we're going to dive into 2 different approaches to safety. So we've talked about existing conditions for pedestrian safety. We've talked about our prioritization of safety. But now I want to talk about two different approaches to safety. And this will kind of help us frame the rest of the presentation and the rest of the content that we get to. So on the next slide, there's a lot of text on this slide, but I want to really dive into every single line because I really think it's important. So the conventional approach to safety is what we've been doing. It's sort of the status quo, prioritizing motor vehicle travel, whereas the systemic safety approach, or you'll also hear me call it the safe systems approach, is more, it really does prioritize and hold paramount safety and reducing and eliminating traffic fatalities and crashes. So let me go line by line. They're all important and they're all connected. So the very first thing is that the conventional approach to safety assumes that you put signs and markings and traffic signals out on the street. We have traffic codes and laws and rules of the road, and everyone should just obey. But the reality is that people are human and people make mistakes. And so the safe systems approach says, hey, folks are going to make mistakes. How do we make sure that if they do make a mistake, it doesn't result in a fatality or a serious injury? In response to folks making mistakes, the conventional approach might say, hey, we gotta just provide enforcement, right? That's the solution. People should just be enforced into obeying the rules of the road. And the safe system approach says, yes, enforcement can be part of the solution, but maybe it's not the only solution. And maybe there's more sustainable ways to make sure that our streets are safe. That doesn't depend on a speed van necessarily, or an officer, or someone out there making sure that folks are following the rules of the road. The conventional approach says that we should prevent all crashes, that every crash is equal and the same, and that we should just get to a point where there are no crashes at all. Whereas the safe system approach says crashes are going to happen, and maybe it's okay if it's only property damage. If it means that we don't have any more fatalities, if it means we don't have any more serious injuries on our streets, maybe that's okay to have just those property damage only crashes. So those crashes that may be, really slow speed rear end crashes, or maybe crashes that are primarily side swipes or anything like that. But the ones that are really severe, those are the ones that we're trying to tackle in the safe system approach. The conventional approach says that deaths are inevitable. It's just a part of doing business. We just assume and kind of tolerate, hey, if we're gonna make it this easy for folks to be able to drive around, that it's just, folks should just expect that there are going to be deaths. And I, as well as the safe system approach, says that's not acceptable. Deaths are preventable, and there's a way, and there are strategies to get to that point. The conventional approach tends to be fairly reactive, so we see where crashes are happening, and then we say, hey, let's fix those locations, which I think is a good thing, but the safe system approach also says that we should focus on the system. So the geometry, the operations, the characteristics of one intersection that happens to be a bad spot, those characteristics might also exist at another intersection, but we're not seeing crashes there because people maybe aren't walking there because there aren't the destinations, or maybe they just feel like it's too unsafe to walk there. And then finally, the conventional safety approach says that safety is primarily for drivers. And so this kind of assumes that the majority is the priority, whereas the safe systems approach says that we really need to focus on safety for everyone. So moving on to the next slide, digging a little bit deeper into the safe system approach. This safe system approach is something that has been embraced by Federal Highway. It's something that kind of assumes shared responsibility across the planners, the designers, the policymakers, elected officials, as well as folks that are using the roadway and the transportation system. So the idea is that we plan and design and operate and maintain roadways, streets, intersections, crossings, trails, and then the customer, the client, right, they use that network. And sure, they're responsible for following some rules, and there's some shared responsibility there. But when people make mistakes, planners and designers, including myself, should kind of look introspectively and wonder, why are they making these mistakes? Why is it leading to these undesired outcomes? And then sort of retool, rethink, and reiterate so that we're making transportation even safer. So that's the sort of safe system approach, thinking holistically about transportation. Moving on to the next slide, the conventional E's of traffic safety include engineering, education, enforcement, emergency services. But as we think a little bit more about a different approach, this safe travel for all approach might be a bit more holistic, right? So rather than focusing on sort of departmental and maybe siloed approaches to safety, safe travel for all assumes that everyone has a role to play. And so interdepartmental coordination, collaboration, and the focus for our presentation today will really focus on safe streets and safe speeds. So moving on to the next section here, we've talked about traffic safety nationally in terms of what's happening in recent years, nationally and in Las Cruces. We've talked about how safety is a priority. We've dived into the differences between the conventional approach to safety and maybe a new way, the systemic way, sustainable way of thinking about safety. And now I want to jump into some key principles for safe design. So I'm going to cover about 4 or a handful, and then each of these are accompanied by local examples, which I know that Sujana and Mark Miller are available to answer any specific questions about these projects and about what's been happening recently with these examples. So when we look at this example, South Main Street, we can see that it's 2 lanes in each direction. They're fairly wide lanes. The walking environment isn't super friendly. The bicycle environment isn't very friendly. We're seeing pretty bad speeding. And I might argue that this isn't necessarily an enforcement problem, right? So from 2016 to 2019, we saw 30 crashes per year, and then about a third of those led to an injury. When we see roadways that are designed in a way that encourages speeding, we shouldn't be surprised that there are going to be speeding-related crashes or just speeding violations. On the next slide, we can see a cross-section of what Main Street used to look like, and then after the reconstruction, what it looks like with 1 lane each direction, a 2-way center-left turn lane, a buffer, and bike lanes, and then a sidewalk. And one of the great things about this kind of approach, so some folks in the industry will call it a road diet or a lane reallocation. The idea is that and Federal Highway has some really great supporting guidance around this as well, and some really great data. But the idea is that this is safer, it's more comfortable. It means that drivers aren't speeding in the same way that they might have if they have 2 lanes in each direction. And then the center left turn lane also provides a place for drivers to queue up before they make the turn. Moving on to the next slide. This just describes and explains why speed is such a major factor. And so it's just a matter of kinetic energy, right? So if someone in a car is driving at a higher speed and they strike someone walking, they're delivering more energy to that person's body. And the more energy that's delivered, the more likely that person is going to die. And so on screen here, every single person icon represents pedestrian fatality from 2016 to 2019. There's 15 of them. 13 of them occurred on roadways with a higher posted speed limit, so 35 miles per hour or above. You can see the majority of them occurring in the 35 mile per hour range. Perhaps that's because that's the number of, there's just more roadways that are posted at 35 miles per hour. Perhaps there are more destinations that people walking want to get to along those roadways. Maybe there's a sense of folks that are on those roads but then are speeding. They're driving faster than 35 miles per hour, faster than the posted speed limit. So we're seeing 9 out of 10, 87% of pedestrian fatalities in Las Cruces occurring on roadways where the posted speed limit is 35 miles per hour or above. Moving on to the next slide, when we think about safe speeds, we are looking at streets that are designed for the safe speeds that are desired, what we kind of want, what we expect from our roadway, and not necessarily what folks are currently driving. And anytime we're expecting people walking or bicycling or rolling to be transit, we need to think about lower speeds. And the trade-off is that if we've got higher speeds, folks that are driving are going to have less time to react to people walking, bicycling, crossing the road, and then if there is a collision, the likelihood of serious injury or death is that much higher. A place where we really did a great job, I think, of addressing the speeding problems on Alameda Boulevard. I'm gonna show you data on the next slide, but this was such a fascinating project because right away we saw a difference, right? So on the left side, this is what it looked like before the restriping of Alameda. We've got 2 lanes in each direction. The sidewalk, people walking on the sidewalk, they're right up against a travel lane. It's a pretty hostile environment for people that are driving. But then on the right side, you can see that there's 1 lane in each direction now. There's a 2-way center left turn lane, bike lanes, which provide the benefit of space for people bicycling, but then also provide a buffer between the general travel lane and then the pedestrian lane. On the next slide, you'll see speed data over a course of several weeks. We collected speed data on Thursdays at the same location at Alameda and Hadley. And we saw that before the reconfiguration, about 18% of motorists were traveling at least 10 miles per hour over the speed limit, which was 30. So they're driving, 18% of folks were driving 40 miles per hour or more before the project went in. And then after the roadway was reconfigured, we saw that drop to about 7%. And we also saw a fairly significant decrease in the number of motor vehicle trips as well along the roadway. And so you can just imagine, right? So we've got 2 lanes in each direction. Folks that want to drive over the speed limit are going to find a way to do that. Maybe they get into the left lane and they drive around others. Whereas with a 3-lane configuration, the slowest driver actually gets to sort of meter the traffic behind them. So pretty impressive results from my perspective. Moving on to the next slide, when we think about safe streets, we're also thinking about physical separation for people walking and bicycling from motorists. So that can be infrastructure, or that can be what happens at traffic signals and from a sort of both horizontal and vertical separation. So on the next slide, when we think about time and space, that can happen at signalized intersections, for example. So we'll talk a little bit about some of those countermeasures for signalized intersections. So a great example of this, a local example, are the pop-ups from 2021. And we saw that these installed temporary bike lane extensions along Nevada Avenue and Walnut Streets, and then shared lanes on Idaho Avenue. But these basically simulated separation between people bicycling and people driving, just using temporary traffic cones, basically, the bollards. We saw that respondents felt much more comfortable riding in spaces like these. 35% respondents said that they felt comfortable riding the pop-up, and then 50% said that the pop-up improved the streets. So a great example of providing separation for different modes. On to the next slide, shifting automobile trips to walking, bicycling, transit is another key strategy. And it's one that's really challenging, right? Because you've got to have all the necessary ingredients in place in order for folks to feel like they can walk or bike or use transit instead of driving. So the idea around traffic safety can be connected to the idea around occupational safety. In occupational safety, all of these strategies are effective in one way or another, but they get less effective as you kind of go down this triangle. So the very top, the most effective strategy for occupational safety is to remove the hazard or to replace the hazard with something else. So when we translate that to roadway safety, that means removing cars, right? Cars are the ones that are killing people and seriously injuring people. If we could convert car trips to walking, bicycling, and transit, what that means is that we're going to see more people walking, more people bicycling, more people using transit. That means there's safety in numbers, but then there are also fewer threats to safety for vulnerable users. And then, of course, everything else is important. They can be effective, but they only are so effective if we don't address the first 2 strategies. Okay, so now on the last slide here for this section, wanted to touch really quickly on the culture of safety. And then 3, really, this is not just specific to, this isn't specific to Las Cruces, this is general, kind of across the board. All communities will deal with one or more of these roadblocks to promoting a culture of safety. So the first one is community opposition. Maybe there is a plan or a project to reallocate roadway space to provide a dedicated space for people walking or people bicycling, but community members are opposing losing a travel lane or losing a parking lane. So that's one common roadblock. Another one is political reluctance or maybe a lack of political will. Maybe an example of that is an elected official saying, hey, we've got this funding for roadway safety, but I want to reprioritize it or deprioritize it and then reallocate that funding somewhere else. And then finally, a third common roadblock is the internal practices. This is sort of like, hey, this is just the way that we've always done things, or they could be written design standards and guidelines, or it could just be sort of unspoken policies and sort of unspoken rules of thumb that folks use to prioritize motor vehicle travel when really we should be prioritizing safety. So moving on to this last section, I want to touch on some existing efforts to tackle the problem of safety in Las Cruces, and then I want to jump into just some really quick examples. This is not going to be comprehensive, but I want to jump into some quick examples of how we might advance safety in the short, the medium, and the long term. So moving on to the next slide, I want to touch really quickly on the limitations of crash data. So what this slide is showing is that the top contributing factor, and this is based on MPO's data and data from the state, New Mexico DOT. It shows that alcohol and drug involved crashes, that's the top contributing factor. What this might miss though is that this doesn't represent crashes with multiple contributing factors, right? So someone might have been under the influence, but maybe they're also speeding. And so this is just one limitation of the data that I wanted to touch on. Speeding as a top contributing factor is still it's a significant percentage of crashes that we're seeing, at least in the data. So moving on to the next slide. I want to touch on lighting. 21% of crashes in Las Cruces occurred in dark and unlit conditions. But there's nuance here, right? I want to touch on the reality that maybe there are fewer people driving in dark and unlit conditions. Maybe there are fewer people walking in dark and unlit conditions. But it's still something that is, of course, a safety factor that we want to tackle. So I want to applaud the recent work of city staff to explore and improve lighting across the city using drone imagery. I think it's really interesting, and what a great strategy to identify where lighting coverage is currently inadequate or lacking. We know that city staff are identifying 5 focus areas that will need lighting improvements, and certainly that will have some effect, and we'll love to learn more about that once we get additional lighting in. Moving on to speeding, we know that staff have been exploring automated speed enforcement via speed vans that can be deployed to different locations as needed. Certainly looking forward to the outcomes of that effort as well. But of course we know that this is sort of a short-term kind of fix, right? And we would love to see more self-reinforcing street design that encourages folks to not speed even when there isn't a speed van present. And then finally, the third effort that I wanted to touch on is this intersection safety analysis using artificial intelligence based video analysis at 2 pilot locations. My understanding is that there's a procurement process targeted for March 23rd, and it can identify safety issues using AI and using technology. And so what a great use of technology to get data that we wouldn't have otherwise. So looking forward to seeing the information from those 2 intersections. Okay, so now I want to jump into some short, mid, and long-term countermeasures, strategies, solutions. These are just examples. This is not all-encompassing. And to define what these mean, low short term are low-cost solutions. They can be implemented quickly. Maybe there's signs and markings, that sort of thing. Things that we want to do to respond to existing safety issues, right? Rather than saying, oh, it's just going to require roadway reconstruction to solve that safety problem. What can we do in the short term? On the other side of the spectrum is the long-term solutions. So these are roadway reconstructions, imagining sort of just street design, intersection design, crossing design just being completely different. And the midterm's kind of everything in between that maybe isn't 10 to 15 years off, maybe it's 5 to 10 years off. And then I want to tackle 4 different safety objectives. So one is safe speeds, the next is safe crossings, and then lighting, and then road separation. So on the next slide here, again, these are just some examples, but in the short term, to encourage safe speeds, of course, we can use speed safety cameras, maybe speed vans, that sort of thing. Maybe it's some really quick build traffic calming. So in the form of vertical deflections, speed cushions, speed humps, raised crossings. Sometimes they're asphalt, but sometimes they can be rubberized and they can be installed into the pavement, sort of on a pilot basis. In the midterm category, to encourage safe speeds, we've seen this, right? This is on Alameda, and hopefully we're going to see on Main Street. Reducing the number of travel lanes, narrowing those travel lane widths, providing other infrastructure in the street. This can be done as a regular annual pavement resurfacing, and then of course setting the appropriate speed limits and the design and the operations to kind of enforce that. And in the long term, more permanent traffic calming, and then roadway redesign and reconstruction. Those are going to be some examples of really great strategies to encourage safe speeds. As we move on to safe crossings on the next slide, you'll see some similarities here, but in the short term, we're looking at signs, we're looking at markings, and we're looking at some operational things. So leading pedestrian intervals effectively give pedestrians a head start at signalized intersections, and so it doesn't cost anything, right? It can be a really quick thing. It's more of an operational thing. In the midterm, we're looking at some additional traffic calming, but some median refuges, maybe some curb extensions, that sort of thing. Enhancing pedestrian crossings, so using rectangular rapid flashing beacons. These can be really great ways to draw drivers' attention to potentially crossing pedestrians, and they've seen great success across the country. And then in the long term, maybe we've got an example of pedestrian hybrid beacons here, but they could be full traffic signals if it makes sense to do that. The benefit of these versus the rapid flashing beacons is that drivers are legally required to stop on red. So moving on to lighting, this one's a bit more straightforward, but I think in the short term, the collecting of data, collecting an analysis of data, and then allowing or facilitating residents and others to report broken streetlights. That's a very simple short-term kind of fix. Whereas in the medium to long term, we're looking at just more enhanced lighting, both at the street level, but also for pedestrians. And then in some cases, they can be used to enhance placemaking as well in urban design. And then finally, moving on to separation. In the short term, we've got opportunities and the potential to stripe walkways and bikeways. And then to repair existing sidewalks. We've got existing sidewalk network. Let's make sure we're taking care of it, maintaining it, and maybe even filling in some micro gaps. I imagine that there might be some locations where it's a really simple fix to just connect two sidewalks if if the gap is really small. In the midterm, maybe there's opportunity to reconstruct the sidewalk and reimagine what it looks like. Maybe there is the opportunity to include some kind of amenity zone or landscaping or trees. And then in the long term, of course, anytime there's any kind of roadway reconstruction where we're kind of reimagining what that roadway space should look like, there's the opportunity to rethink that sidewalk and how much space is provided for that sidewalk in the amenity zone and what that experience is like. So that was a pretty quick overview of what we have observed in terms of safety and what we would recommend for improving pedestrian safety in Las Cruces. So I think at this point, I'll hand it back to Shoshana. Thank you.
Thank you, Tron, for that presentation. But before I go to Shoshana, I just have a quick question. So I think what prompted a lot of this work session item was, obviously, there's been a few fatalities as well as people getting injured. Have we identified the actual locations of where they were? And perhaps what are their ages? I say that because when I was when I was a teenager, I used to think that cars could see me, because they have headlights at night. But and then when I started driving, you realize you really can't see them unless they're wearing some type of clothing that's a reflective manner. But do we have the various streets where they had been hit and maybe they were killed? And exactly, I guess what I'm trying to get at is, I saw there was a couple streets that we were going to start as a pilot project, I guess you could say. But is there some particular areas that maybe we need to address right now? Years ago, when we used red light cameras, we identified 5 areas that produced many number of crashes for the car accidents. And of course, the top one was Telshore and Loman. So do we have that data or not really?
Mr. Mayor, Srijana Basnet, so we do have the actual data collected by and presented in report format by our Mesilla Valley MPO, and actually I think their staff is here and they can speak to that. I would also, once they're done kind of talking about that, maybe suggest that our senior planner, Mark Miller, could come up here and kind of talk about what we can do with the data and what the data does and does not really say. So with that, I'll just step aside and let Mr. Dominic Loya talk to that.
Thanks.
Good afternoon, Mr. Mayor, members of the council. My name is Dominic Loya. I'm a transportation planner with the Mesilla Valley MPO. So every year we do collect data for the region. We do put it out in a report format. And if you go to our website, you can actually see the report itself. We have not posted this year's yet. That'll be coming up here in April. We will have that one out. And our website, of course, is MessillaValleyMPO.org. On there, since 2018, we have done a safety report for basically Las Cruces and the surrounding area.
Okay, so we don't have that right now, is what you're saying, or what I'm hearing?
So we don't have this year's, and the other thing too to remember is the way NMDOT does crash reporting, we get the data 2 years back. So basically this year we will be looking at 2021 data as opposed to what is currently happening. So any of the tragedies that have happened this year or this past year would not be included in that data.
Okay. I guess I was just even thinking, Google Las Cruces Sun News, and who got hurt, and probably pull that up. I didn't need a whole lot. Just I wanted to identify the streets. Maybe there was lack of lighting in that particular area. And maybe there was 2-3 people that might have got hurt that way. But okay, let me turn it over to my colleagues and see if they have any questions. I didn't know if you had that data or not. So, Councilor Bencomo, Councilor Flores, Mayor Pro Tem.
Thanks, Mayor. And thank you, Trung, for the very insightful presentation. Just real quick while you're here, Councilor Corin Graham and I sit on the MPO, and just last week we got a report on lighting safety, which I just sent to Christine, if she can share with you all. But so just on the point of the data, at MPO we have discussed lobbying NMDOT about this 2-year delay of data, because it's just frankly not okay. I think it delays a lot of safety conversations we can be having, and I know that we were potentially working with other MPOs across the state to sign on to something similar, but it is a problem. Like the El Paso MPO gets data pretty consistently, so I don't know what the we've heard many excuses about why that is, but I think it should be something that is remedied. And then additionally, Mayor, I did just last week ask for the same thing. Just can we get some raw data from last year? From my research on the Sun News, I think there were 7 fatalities, pedestrian fatalities last year. Of course, the locations are sort of all over the place. The one I remember mostly is on West Picacho, but I did ask the MPO last week if they could provide some of that for us, just on that note. And then just a couple of questions. This may be for you, Srijana, but the presentation noted that there were 5 focus areas regarding lighting. Can you share with us what those are?
Mr. Mayor, Councilor Bencomo, Srijana Basnet. So I would defer to my colleague Sugu Lee from Public Works, since they're the department that is doing that particular study.
Thank you.
Good afternoon, Mayor, Councilor Bencomer. My name is Sugi Lee for the record. There's a 5 focus area. One is the downtown area, one in the one on the the east of the downtown area, and then all the historical area, that's the second area, and then another area on the further north of the US 70, and the west of the Elks, and then another location is a far east. That's about the area. We have a 5 focused area.
Okay, thank you. Will you send that to us, that information at some point? It doesn't have to
Yes.
be today. Thank you.
We have the map to show the exactly 5 location.
Okay,
And
thank
I'll
you.
provide through the district manager's office.
Thank you so much. I really appreciate that. I had a couple other questions. So Trung, I really appreciated that framework you laid out at the beginning of the conventional versus systemic. I thought that was a great frame to start this conversation and keep moving forward. And I very clearly heard you say this sort of moving away from the hotspots versus the entire system, which is, of course, ideal, right? Like that's where we want to be. And I also, I think it's important that we start somewhere, right? And so I think, like, for example, these 5 focus areas and then the couple pilot projects. I mean, what is your suggestion, as expert there, like where do we begin? Where is the best way to begin?
Yeah, that's the $1 million question, I think. What I would say, and this is where a lot of communities start to think about where they prioritize their limited funds, right? There's only so much time, there's only so much funding, there are only so many resources, there's only so much energy, and part of the process when we start thinking about systemic safety is imagining where we're going to get just the most return, right, on our investment of funding. And so a lot of communities will identify what they call an HIN, or a high injury network. And the idea around that is they're sort of the roadways that you would expect, right? So they're generally created with a lot of data and analysis behind them, but you can kind of guess, anybody could guess where crashes are occurring the most and where we're seeing the most fatalities and serious injuries. And so if we identify those corridors as part of the HIN, we're saying, hey, we need to prioritize funding on these corridors. Or if there's a project proposal to redesign or address safety or do something along those corridors, we should give extra attention and maybe allocate more funding to those locations. Another way of thinking about it, because it can be challenging and sometimes it can feel just so daunting if you think about an entire city. Sometimes what folks will do is they'll imagine a project. Maybe it's Main Street, maybe it's something else, maybe it's University, and they're gonna say, hey, we're gonna design this roadway in the design phase. We're gonna design this roadway to have 0 traffic fatalities and serious injuries, and we're gonna monitor that. And so rather than saying, oh gosh, the entire city, how are we ever gonna do this? It feels like there's no rhyme or reason. What if we just started focusing on what we can focus on, which is maybe one corridor and we have immediate impact on something like that? So there are multiple ways to do it, but you also see that at the state level, the New Mexico DOT is about to put on advance an effort to develop a vulnerable road user safety assessment. And part of the requirements of our VRUSAs is to identify these priority locations. And so maybe they're not hotspots, but maybe they're places where we're expecting communities and partners to prioritize their funding. So kind of a short answer to a really big question, but yes, we got to start somewhere, and a lot of times that's identifying focus areas or focus corridors.
No, thank you. I appreciate that. That sort of got my wheels turning about, I mean, up here as policymakers, and this one's for you, IFO, I think for next pedestrian safety conversations, I would, and I know the next steps are here, but I would like to see more of a flushed out like budget plan. Here's what the budget we would need to improve lighting safety across the city. Like what's the big cost? What would that actually cost? And then where do we start? What's the big cost to reducing speed limits across the street, right? Like very specific numbers, because I actually do think this is a key priority is pedestrian safety, given the number of fatalities last year, but then every year. And so for me, that's something that I'd like to see moving forward, especially as we head into a budget retreat where I'd like to understand what to advocate for. So that's one of my big asks, I think. And then my other ask, as the presentation was going on, I was thinking about, and this is for Public Works, about some of these many constituent-driven asks for road diets and speed limit changes, and curious if there's space to advocate to remove the very lengthy process sometimes that is in place in order to get there, right? Where it's like you need the majority of the people who live on the street to agree to be able to move forward. You know, I mean, you could ask, why would anybody not want safer streets? But as you also noted in your opposition slide, that happens all the time. And I actually have had constituents say, why did you put those things in the middle of Alameda and Madrid? And sometimes it's safety over convenience, right? And so I am curious about that process for Public Works, if that can be relooked at, and how could we make it easier? Oh, I'm looking at David, Tony's down here. How can we make it easier for to begin road diet, speed limit processes that are brought on by constituents?
Excuse me, Mayor Concha-Pincomo, this is Tony Trevino for the record. Yes, we have actually been talking about that, about the process we have for speed tables and so forth, chicanes and the way that it is. And I believe Shoshana's already working on that kind of also. So with the Real Lights coming through, the Real Lights Las Cruces, new design standards, that is part of the process that we are looking at. Yes, ma'am.
Great, thank you so much, Tony. Just when I think I have a great idea, you already had it, so thank you. Thanks, Mayor.
I think it's going to be Mayor Pro Tem next, because I think, but before she does, I have to also put a plug in for perhaps PIO can do a campaign for, let people know that, hey, if you're going to be walking at night or riding a bike at night, you might want to use a light. You might want to use some type of material like that. And I mean, I know a lot of people don't necessarily watch our CLC Channel 20, but we may want to put it in media as well as in the print. And so the other day I saw a bicycle. He had his white light on, his red light on, but he had blue lights on his tires. And I mean, he definitely could be seen. So I mean, those are the type of things that if it wasn't at night, I would have tried to find out who it was so he can come here and be on one of our videos. But anyway, so Mayor Pro Tem and then Councilor Flores.
Thank you, Mayor. Thank you, Serjana. And I'm sorry, I forgot. What? Mr. Bull. Thank you for your presentation. I've been waiting for this for some time. This is a really important issue for me. I'm glad that we've hired you and that there's continued conversations internally about next steps. You made mention specifically the area with the road diet around Alameda and Picacho, and honestly, that took a significant amount of time and people to address this, and I know that we're better for it, for sure, but this happened pre-COVID, and it was a very lengthy process. So I definitely agree with Councilor Bengomo that the process probably I would like to see it shortened, because when you hear about the crashes and you hear pedestrian deaths, those are always very alarming to all of us. And I often feel with a lot of our joint powers of our JPOs that there's sort of a gap in the information that's being shared at one time with council. So I was going to wait to talk to IFO at my individual staffing with him. But I understand at our next, at our retreat that maybe city staff will be the only ones presenting regarding the number of maybe priorities that need to take place, and we're not going to hear necessarily from our JPOs. And I think that I would like to see the presentation from our Animal Services Center, those boards like MPO, those boards that we share in common with others. And then I'd like to request, I was really looking forward to hearing the data specific to the areas where the crashes were at, because I know you've been working on this for a significant amount of time, and the data's here and the data's there. But I think it also feels like there's a lot of gaps. And we, again, don't hear that information specifically, and you're asking us to go into a website, right, to look at the data without any conversation about that data, and to me, I think that's not the way to go. I feel like if we're going to do this, you need to have all the partners here prepared, right, to have those conversations, answer questions, and I'm wondering if this went through our transportation, PRC, or health. I know it didn't go through the health, and those are opportunities to bring everybody together and really hash out some of this stuff, and that way we have that information prior to these sorts of work sessions. And so my question was, do we have an inventory of the speed limits across the city in those areas where you're connecting higher level of crashes or pedestrian deaths? I mean, do we have that currently? And then the second question would be, is that how, or one of the factors that you selected those 5 areas that you just spoke of?
Yeah. Mayor Pro Tem, IFO was able to find some data, although it's a couple years old. I think he sent it to 2019. He sent it to Adrian, and Adrian should have sent it. You should have it if you want to put it up. It's interesting. It's a combination of, you know, whether it was a car crash or a pedestrian or a bicycle. So, and you can see various parts throughout the city, and these were the fatal crashes in 2019. Yeah. So this at least gives us some
idea.
Yeah, some idea.
Sure.
Right.
Sure.
So can somebody pull that up?
Mayor and the Mayor Pro Tem, yes, we have a data to show where is the speed limit and where is the accident happened. And then there's 2 different approach we're trying to do. One is find out how we can address for the long term. As everybody mentioned, right now we're focusing on short term, mid term, and the long term. Mm-hmm. So we have to look at the long term, how we can make a different code to make it more safer for all the user, including the vulnerable user, bicyclist, and pedestrian. The second is how we can address the issue reactively, which is what we are also doing it. So whenever we have any accident happen, traffic engineer, we've been notified from the police, and then we look at what the cause. But unfortunately, more than 95% of the times, it's not the engineering or anything we can address, because it's more for the drivers or the pedestrians, the mistake. You know, as you saw that one of the statistics, almost more than 90% of the cause is the pedestrian, the user's mistake, unfortunately. But still, we're trying to find how we can minimize the damage or reduce the damage. That's what we're trying to do it. So that's the reason we focus on the corridor, as you know, the mayor mentioned. So we, at this point, we focus on the 3 corridor. One is the El Paseo. There's a lot of the pedestrian accident. And then also, we want to see what's going on the Roadrunner. That's also city street. And then also, we would like to see how we can make an improvement on the university. And then also, there's 2 other corridor, which is not belong to the city, which is the NMDOT, one on the North Main. The most recent, the fatality happened at that location. And then another one is on the Picacho. That's actually the NMDOT. So we closely work with the NMDOT, express how our concern is, and then how we can work together with the DOT, because we cannot just work alone. So that's the reason we continue to work together, and then also trying to find the funding, because sometimes we're not able to do even the analysis, the Banco ask about what's the cost. So for example, the presentation I included in the presentation for the intersection safety analysis with the AI, it's about $10,000. So in order to cover the entire city, we need about $1 million. And also we've done several, the speed study along the major corridor, that's about $200,000 to the $300,000 cost. And then even the time is about 6 months to about a year. So that's the reason it takes a long time to analyze what's going on and then how we can address it. Once we figured out the issue, then also we need to take a time to do the design. And then once figured out the design, then also we need to define the way to funding.
Sure.
Yes. And then also the difficult part, as everybody mentioned about the procedure. But unfortunately, our code specifically spell out how to do it and then what's the process. So we cannot skip the process.
No, I'm not asking you to skip a process.
Yes,
Absolutely. If there's a code, we want to follow it. I'm not asking that at all. But I don't know very specific in terms of like, for example, speed tables.
Yes.
I don't believe there is a process spelled out with a time frame that it takes to do that. I think there have been people within the neighborhood. There's a process that internally it was suggested, and that's what it's like, and this is what you advertise when people come with concerns about speeding in their neighborhoods, right? Something of that. I mean, it doesn't come to council, so council gives it the stamp of approval, right? I'm not suggesting that you not follow a process. What I'm asking is, and that's very helpful for me to understand sort of the amount, from day one from 6 months to a year, right, to analyze all the information, understanding how costly it is, and then what those more long-term solutions or strategies are, and then how to basically advocate to us and maybe grants that you will need to go for, right, to be able to do all this. So will you have this information at our strategic session, our budget retreat? And what it would look like, or how far along are we in terms of providing the information, the analytics, to then develop sort of the strategy moving forward? Are we sort of at the beginning stage? Do we need to do more analytics? Where are we at?
Mr. Mayor, Mayor Pro Tem Gandara Srijana Basnet, I would defer to the lighting study, of course, to Tony or Sue. But if you're talking overall about all of the data that can go into something like this, for example, you mentioned some of the traffic calming, like speed tables, you mentioned that. In order for us to be more proactive and not simply react to requests as and when they're noticed, or for areas that maybe do have the biggest voice, as opposed to areas that really do need it, but they just don't have time to show up to City Council maybe and express their views. We want this to be a holistic approach as much as possible, because I just off the top of my head, I can think, just addressing a traffic issue with creating speed cushions or humps could be problematic in the long run if we talk about emergency vehicle access, or, there are other things involved in that as well. And so we do want to have the best possible solution. With that being said, I am kind of lingering on this slide a little bit because this was the last slide to the presentation, so I'm trying to wrap up. But you've already established a City Council policy direction for us. You've already said we prioritize pedestrians and cyclists and transit users. And so we have taken things like your comprehensive plan and active transportation plan. The example of Alameda and why it required such a different kind of, I would say, a second knock on the door to remind us that it is the #1 implementation item already identified in our active transportation plan. And it only took us a few years to come back to it and actually get it done. I think what we're missing is what you've said repeatedly here. There are gaps to how policy is implemented. And I think one of the visionary things that our city manager has done is to recognize that gap and create something, an actual line of business to the city that's called planning and implementation. And so we are actively working on identifying the data, analyzing it, and creating solutions. It's just maybe a little bit more time consuming than you would like. However, the goal is to catch as many things as we can with one solution. And so in the CIP retreat, my hope is that you all will kind of have a more hands-on experience in looking at this information, in digesting it, in asking the questions that you need to ask in order for us to have a really good process moving forward. And so with that, I'm going to hand over to Mark, who can just maybe address some of the data that you are, or that you were hoping to see today, and just talk about it just a little bit, so you can maybe understand our hesitance to just take one aspect of one data set and say this is going to address that problem directly and completely.
Mayor, City Council, Mark Miller, Senior Planner. If you just give me one moment so I can see if I can bring up some of the data that we've been working on. So I could start by just kind of refreshing everyone's memory, City Council, and our audience as well. We shared this previously. This is through our OpenGov platform, the transparency platform that we do have. Here we have a specific story related to active transportation, and it's kind of our one-stop story where we can see all the different bits of data that we're trying to actively track and regularly update. The most recent years on this, you'll see, are kind of 21, 22, I believe, but we're currently working on updating that kind of as we speak. You can see, the amount of bike lanes that we have across the city. How much striped bike lanes do we have? Where are our sidewalk gaps? This is a effort that's been worked on with Public Works, kind of an interdepartmental effort to try to track in real time where our gaps are, when they're being filled, whether they're being filled partially or wholesale. We also have just a few different, key measures related to the right-of-way. How many trees do we have in the right-of-way? The sustainability aspects of trees in the right-of-way, of street trees, but then also when we talk about kind of creating a place around public thoroughfares, constraining the right-of-way, framing it so that we can kind of slow down those speeds a little bit. That's a really important measure to keep track of. How close are residential dwelling units with near trails? How much do we actually have people walking or biking? And we also are tracking pedestrian and cyclist crashes. You'll notice that this is actually more recent data than what was in the presentation. The reason for this is because these are straight numbers from PD. This isn't going through the process that you all were discussing a minute ago of that 2-year lag and what the MPO relies on. The drawback is that this isn't spatial. It's not mapped out currently. There is that verification process that the uniform crash reports from LCPD goes through with the state and then goes to MPO. I think you're all aware of that. We're also tracking the walk score and a few other items that aren't on here. So this is just an initial thing I wanted to bring back up to your attention. This can be shared with City Council, of course. But more to the specific crash data that we're discussing today. In preparation for this work session, we did utilize the MPO data, that historical data up to, I believe it was 2019, and tried to kind of take it to the next step and see what relationships, what correlations we can find, leverage the work that the MPO does currently on this. And I guess the thing that I'll highlight for you is this is something we are working on. We're working on right now. And the delay in presenting this to you is because of the complexity and the nuance of really trying to spatially, statistically analyze it in a way where we can bring you a finding. There are so many different variables to the why related to the where of these crashes that doesn't live in the data, that isn't collected necessarily, that it just makes it a really difficult answer to pin down. We hope to try and develop this a bit further and then make this available. This is the raw data. I will say this does not cover, Mayor, to your point, this does not cover those most recent crashes because this is relying on the MPO's crash reports, which is only up to 2019, as Dominic highlighted. So we did just want to put this in front of you and show you that this is something that we're working on and trying to bring that policy connection and yeah, I'll leave it at that and stand for your questions.
Well, thank you. It probably would have been easier to ask Justin Garcia from the Sun News to report because it looks like he did a lot of these articles, but I already found the 7. One was at Idaho and Locust. One was at Picacho 17th Street. It was jaywalking. One was at Baton Memorial East near Oregon Mountain High School. One was in the Target parking lot. I vaguely remember that. Another one was I-10 south of Las Cruces near Vado. One was at Spruce in Virginia, and the other one was near Amador in West Picacho. I guess a train hit a pedestrian. So those were the 7 in 2022. And so I just wanted the council to have an idea of where these happened so that we can see where this project or pilot that you all want to do or have us do and how they correlate with this. And so, and some of these probably couldn't have really been avoided. I think like one of them may have been driver inattention, and I didn't really get a chance to read the Target parking lot. But this gives us, council, I think, an idea. I mean, what happens is we hear about these and then, it just obviously causes a reaction. But when you step back and look at it and you read more of the details, but it's still important to let the public know, hey, we really can't see you. The driver can't see you. And I want to say that the Department of Transportation did some type of a program, maybe 10, 12 years ago, about the same issue, that we can't see you, or you can't be seen, or something like that, and they would hand out, it was a statewide campaign, and maybe if we did that here locally, just something to highlight, to let the skateboarders, the people who ride the bicycles, and the people just walking the streets, hey, you might want to wear something that's reflective. I can still remember as a kid, my dad, this is back in the 60s and 70s, he'd wear this, that tape, when he'd go for a walk. I forgot what this was, reflective tape, and I used to think, but then as I got older, I realized what he's doing. And so it's just something about letting people know, hey, you might think that cars can see you, bikes can, but we can't. And if you can wear something that's a little reflective, that would be good. Councillor Flores, and then Councillor Karan, and then Bencomo.
Thank you, Mayor, and thank you all for your presentation. I think my question or confusion or inability to understand everything you do rests on the fact that we have different factors that contribute to the accidents, quote unquote, the instances where people are injured or killed. And I think it's wonderful that you're adhering to the realize Las Cruces or the comp and all that. But it seems to me that I think we had like 2 or 3 bicycle incidents within weeks or months of each other. And we recognize that we have streets that aren't really safe. Roadrunner Parkway, for example, I cringe that, I don't understand how any planner in his or her right mind would have put an elementary school on a road that is really arterial. Roadrunner Parkway, the speed limit is 35, and if you're going 50, it's slow. And a lot of people use that crosswalk at the school, and I just cringe because and then the sidewalks there on Roadrunner Parkway are so narrow that you can barely walk with a dog on there. And I would never walk. I think I walked it once and didn't feel safe and never did it again, and certainly not with my dog. So it seems to me that, this is just someone who isn't educated in the field, but it seems to me that you would look at a situation that, to correct a situation that caused a death, or there's been several deaths that are similar, and try to rectify that, even if it's a small section, maybe if it's just a small step. But I guess, I guess you're looking at the entire city. You're looking at each and every incident that is a safety issue. But it seems to me that there are issues that are definitely life or death. We have more bicyclists on the streets now, and we still haven't done anything to make bike trails safer, either by making them wider, slowing down traffic. And I think, for example, if I were a police officer, with all due respect to the department, but if I were a police officer and I was on how many tickets can I give out today, and will I get a raise for it or something, I would hang out on Roadrunner Parkway. I go 35 miles an hour, and it's like people, and I slow down, especially in front of the 2 schools, El Camino and Desert Hills. But people are going by at least 50 miles an hour. And there could be so much prevention. There could be police officers issuing tickets right and left there. They could, make their quota in one day probably. So, that's a side issue, but I just don't understand how it boggles my mind. I don't understand how say, for example, your department just said, you know what, we're based on the fact that we have 2 or 3 bicycle incidents where people died within a short period of time. Let's look at that right now. Let's focus on that. Let's get money for that. And let's take all this wonderful stuff that Mr. Vo presented and consistent with the presentation, and let's move forward, because I think the data is there. And that's the part that just boggles my mind. And, you know, year after year after year, and there's no movement. And it isn't a criticism, it's just an observation. And again, and I prefaced it with the fact that I'm an ignoramus in the field, but I think I share the concern and the questions a lot of people do in the city. And to me, one person dying because of something that could have been prevented as a result of a relatively minor fix-it. And I'm saying relatively minor because I'm not saying, oh, build a huge bridge or build a huge street just for bicyclists. I'm just saying whatever contributed to that particular accident. So, you know, I'm just basically talking off the top of my head, and again, sitting, you know, just sitting and watching it. Thank you, Mr. Mayor.
Thank you. Councilor Coran?
Thank you. I was hoping we could perhaps go to the triangle slide again, with the upside-down triangle. Thank you. This is actually, I think what a lot of us are getting at. I think the mayor sort of is alluding to the bottom of the triangle here, and I think I would just like to say I think we're looking at, hopefully we can think up in this pyramid, and that's the I think expectation and accountability that we have to our community to re-engineer things as we can, change the things that we need to, and address systemic things like a culture of speeding, or cultures of not stopping at red lights, and really focus all of our attention. And I think the idea of having a more adaptable code, I really do hope that the Realize code will enable us to shift how we change these things, and I appreciate you all alluding to that, so that we can be more adaptable, change our roadways as we can, and address systemic issues. I would argue even looking at 1 year of crash data is really, you know, hard to put in an epidemiological context. So I really appreciate you all looking at this from a bigger perspective and thinking about the top of the pyramid. And I think we're all committed to prioritizing that in our upcoming conversations about the CIP in particular. So I just wanted to thank you for including this, because this is the basic sort of public health model of addressing systemic issues, and I think most of us are committed to doing things in this way. Thank you, Shoshana.
Councilor Bencomo?
Thank you. Can you go back to the convention versus systemic? And I wanted to just say this because I think I was a little bit triggered by some of the narrative earlier around, because I just want us to really breathe and live this. I think it's important to shift away from victim blaming, right? Like, pedestrians don't pose a risk to vehicles. Vehicles do pose a risk to pedestrians, though. So the education cannot be solely on the pedestrian. It should not be. I think that's irresponsible. And so I think part of how we approach this issue as policymakers as well is really from this frame and perspective, because I think it's actually even more dangerous to say, don't get killed by a car, as opposed to saying, hey, cars, be careful with pedestrians because you could kill people, right? And so I just wanted to reiterate that as I was hearing some of that frame being repeated.
I also think, thank you for those comments, Councilor, but I also think that the pedestrian has a little bit of skin in the game as well. I mean, you don't want them just dressing up in clothing that they can't be seen. I mean, it's tough nowadays. There's so many obstacles, whether it's the sun in their eye or whatever may be the case. But I hear what you're saying, but I also think it's important that they be, and again, like I said, when I was younger, I didn't realize that they can't see you, even though you're looking at them and you say, well, can't you see me? But no, and then when you start driving, you realize, no, you can't see them sometimes, especially at night. Okay, so what was,
I have a question.
sure, go ahead.
Thank you, Mayor. And thank you again, Srijana. So do you look at areas that, I mean, I'm not saying they're a quick fix, but do you look at areas sometimes and think, you know, this could have been prevented, or some tragedy or an accident, a death, this could have been prevented if we would have had a lower speed limit, or this could have been presented if we had another crosswalk, or this could have been presented. And I'm thinking about not a quick fix, but something, for example, have more crosswalks at, you know, like the big streets. And I know that Tony and David, Trevino and Cedillo, I've walked with them. And we we had a constituent who was asking all these questions, and they they informed that, well, because of the design of this street right here, it's not required to have a crosswalk, or the way the streets are set up, you don't need a crosswalk. And yet you look at Sonoma Ranch Boulevard, and you go, dang, there should be more crosswalks, there should be more semaphores, you know, street lights. Regulating traffic there, because that's even faster than Roadrunner in my experience. So do you do that sort of stuff, or is it just too simplistic? Yes, it's too simplistic.
Mr. Mayor, Councilor Flores, I think that is one way to address and enhance the transportation system, is to look at the data and to see if there's something that was preventable or that we can fix moving forward. However, I think this is the piece that a little bit gets missed, because we do have a lot of, I don't want to say siloing necessarily, but we do have a separation of expertise, and we have a gap in transportation planning at the city. And that's something I'm gonna mention at the CIP retreat to you all. But this idea of having an approach to fixing a solution, I also want to be very careful, because I'm kind of looking at legal right now as to how I phrase this, but I think with better design and long-term thinking, we can provide solutions to these problems. I don't know that there's a quick fix right now, because sometimes you can place a crosswalk and make it more visible. However, it might not be visible 24/7, and it might not be the best location for the crosswalk, because the street was not designed to be crossed at that point. So so it's not a straightforward answer, and I can't answer that for you today.
Yeah, Ifo had something he'd like to add.
Thank you, Mayor. Just a couple of thoughts before we conclude with this item. One thing I want to mention, you know, in regards to gaps is, you know, I think we touched upon it a little bit in the presentation just at the beginning about how we have these different plans. We have Elevate, we have all these, there's plans coming out of our ears when we talk about, you know, all the things, great things we're going to do for the city. And we'll go over this at the budget retreat, but this is, I just want everybody to recognize this is pretty trailblazing. I think we're going to be closer than we've ever been with this new line of business that's created. So now you have long-range planning, you have performance management, and the CIP all in one area under the direction of Srijana and her staff. And so we're going to be taking plans to implementation, hopefully faster than we've ever done, and more complete than we've ever done. And this is just one aspect. I don't want to get into much more detail, because the agenda item was pedestrian safety, but this is all a part of the grand plan, right, to really move this city forward. And, you know, I've certainly, in my previous city, and I know cities around the country, I don't think they have it this way. I think this is really something that's innovative, that's come from staff, all departments, and particularly Srijana and her staff. But, you know, this is going to require the coordination and teamwork of the entire staff, from public works to utilities to everyone together. And so I'm really excited about it. So you'll see in our budget retreat coming up, just to manage expectations too. So the first day, we really don't have any other room. We don't have room for any other JPAs to present. What we're proposing is maybe a work session. I think Barbara sent me March 27th might be our next available work session where we can invite them. The hope is that they're coming to your individual boards and presenting thoroughly, but having a work session specifically for these JPAs. We just have, we've only been able to fit 5 of our own departments, and that's a full day. And so that's why we haven't planned with the JPAs to present, but we can certainly have a work session. And then the whole next day is all CIP. That's all CIP and talking about strategy and where this line of business is going and, some exciting stuff for the future. But we are going to implement this plan. It's all going to come from our comprehensive plan, and that's going to be directing our CIP as opposed to other processes that we have, but it's going to take the coordination of the entire organization to be able to have that buy-in. And so that's why we've dedicated the whole second day to talking about this. And hopefully the gaps will be filled, will be, again, more complete and faster to get to implementation.
Okay, thank you.
Just a point of
Your
information.
closing comments?
Yeah, right. I'll be here 10 minutes. Now, Mr. Peely, some of us are going to be in Washington, D.C. on the 27th of March.
Counselor, I think the next one will be April 10th. If you're okay to wait till then, we can plan for that.
Yeah, there's about 4.
April 10th?
Yeah, it's April 10th. That's your birthday, is that? Okay.
Thank you,
Thank
Counselor.
you. Thank you.
Was there some other, did you want to say something?
Yes, Mayor, I was just wondering before we move on if we could entertain some brief public comment. I know we have, I don't know if anyone out there is itching to speak, but we have members
They're
of our...
finished with their, you all are finished with the presentation, Shoshana?
Oh, yeah, sorry about that.
Yes, sir.
Okay.
Thank you.
Sure. of
But I
course.
know we have some members of our Bike and Pedestrian Advisory Committee.
Okay, let me,
Thank you.
let's see, who in the audience is here that wishes to speak? Just raise your hand. 1, 2, 3 people. Okay, so 3 minutes each. If you want to come forward, Andrew, state your name, please. And good to see that you stay involved after you retired from the fire department.
Got to do something, right?
Yeah, that's good.
Mr. Mayor, Council, this is Andrew Bencomo, the pedestrian advisor for BPAC. So some of the comments, I'm super happy to hear this, that people are talking about this, trying to improve safety for walkers, bikers, runners also. So not wanting to create waves or anything like that, one of the things that I heard, and I hated to hear it, was when the comment was made that the traffic systems are not the problem, it's the users, it's the drivers, I'm saying drivers too, drivers and walkers. When there's accidents, it's not the system, and that's exactly what the presentation was saying not to do, and so I hated to hear that piece. Also, a lot of times the first thing they want to do is let's just reduce speed limits, let's change the speed limit signs, but we know that people just speed. So the treatments of the roads, the reduction of lanes, the chicanes, those type of things, those road treatments are really going to be the answer to what we're looking to provide here for as far as safety goes. That will help to reduce traffic speeds, things like that. Obviously, they are expensive to do if you have to add them in afterwards, but they can be built into projects. One of the questions they asked was, where do we start? I think you start with the low-hanging fruit. What can we do? Can we change the traffic timing signals? I know in San Diego, the traffic lights change, but they change for the pedestrian first, and they hold the traffic so that they can cross for a little, start to cross, and then go. Because I myself have been guilty of that. It changes, I start to go, and there's somebody trying to walk, and I didn't see them. I'm as guilty as anybody. So those systems are what are going to do it, not relying on people to do the right thing necessarily, though some will. As far as trying to identify specific locations where people are killed, Again, we're going back to focusing on the micro things instead of looking at the whole system. So while we do need to do that, I would like for us to take the step back and look at the bigger system as they have presented. That's going to be more important than anything else. Also, just an example of what just occurred too, where we're missing the boat sometimes. We just did the geo bonds. They just finished those wonderful trails that we have. But if you look at the crossings at the roadways, there's one sign put up, so pedestrian crossing. No treatments on the roads, no crosswalks. How did that happen? How was that not part of the budgeting and part of the system that was put in place? The trails are great, but the safety system of it seems to be lacking somewhat. So, and then back to that push, the Alameda change, and the system and how long it takes. We were told that, and I may be wrong on this, we were told that a traffic study was done, but then it was too old and needed to be done again. When nothing happens but traffic gets worse, how does a traffic study need to be done a second time when traffic just keeps increasing? Now, I'm not a traffic engineer, so I don't know, but that push was done, I'm out of time, that push was done by the public going to counselors and forcing that to happen. So it was too bad it had to be that way, but that's how it happened. I may be totally wrong on that, but that's my perception. Thank you very much.
Yeah, thank you, Andrew.
George Pearson. We talked some about speed. Currently, unmarked roads have a 30-mile-an-hour speed limit. This includes almost all the residential roadways. Pedestrian vehicle crashes at 20 miles an hour have an 80 to 90% survivability rate, but at 40 miles an hour have an 80 to 90% fatality rate. That was reflected on one of the slides in this presentation. Speed is an important contributing factor to these crashes. An action item that can be taken to help would be to revise Las Cruces Ordinance 27-12-6-1.2 and change the default unmarked business and residential districts roadway speed limit from 30 miles an hour to 25 miles an hour. Changing the speed limit itself is only a partial solution. It would send the message that council is looking at this and raise some awareness of this, but we will have to look at the design issues. People will drive at a speed that they perceive as safe. Every one of us has gone 5 or more miles an hour over the speed limit when even intending to drive the speed limit on the road. The street design changes are needed. The City Council can make this happen. Budget season is coming up. You've talked about this, but I wanted to reiterate that we set aside funds and support some pilot projects to improve traffic safety. Such projects can be done with paint and signs and maybe temporary bollards or mini traffic circles. Let's look at changing traffic lights to give pedestrians a head start to cross an intersection. Or maybe we need some no right turn on red signs at high pedestrian intersections. We've been talking about traffic safety for some time, but with limited action. I hope this will deserve discussion during the budget process, and we can make Las Cruces a safer community. Thank you.
Thanks, George.
Good afternoon, Mayor and members of the Council. My name is Ashley Curry. I'm the Las Cruces Public Schools Safe Routes to School Coordinator. And I just wanted to first and foremost say thank you so much for bringing this agenda item up. Like Councillor Gondar, I've been looking forward to this for many months. And I would also just like to say, as I think you're all commenting as well, this isn't a one-time event. This isn't something that we check off a list and say, thank you, we address pedestrian safety, and we can move on and revisit it in 7 years' time. This needs to be an ongoing and constant discussion. I know that we have had many start and stops to the active transportation department here within the city, and it's very unfortunate that that's currently an unfilled position. I personally, from the outside, look at it that it should be an entire department. I work with cities around the nation and look at what other people do, and I don't know that there's anybody that's our size that just has one person who would be in charge of heading this all up. So I may be maybe speaking out of turn, but I think if you're going to be looking at budgets, look at paying somebody appropriately for that position so that we can get a high-quality person who's invested in staying for the long term, and also having people to help that person. All of these things that have come up today, all of these events are one small item on each and every one of your to-do lists. But if somebody had that as their full-time job, that would be an enormous job. And to be able to actually work together with all of the departments and cross-department, I think that that is very key. I'm very invested from the school district's perspective in working with the city and with the MPO and with the town of Mesilla, the county, the DOT, on pedestrian safety issues, because as you saw from that inverted triangle, the number one thing would be to eliminate vehicles, and obviously that's not realistic. We're not going to go to a pedestrian-only community, but one of the biggest causes of pedestrian congestion is schools. So if we can make our streets safe for kids to be able to walk and bike to school, we can reduce a lot of those conditions around the schools of traffic congestion. And as Councillor Ferreira said, one of our walks is along Roadrunner to Desert Hills. It's a scary place. There's no buffer. We have kids right up there against the road. It is not, kids are squirrely. Kids are unpredictable. We do our best to control them. We do our best to educate them. We do our best to teach them to wear high-vis clothing and to be visible. We do that when we go into the classrooms and work with them. But at the end of the day, kids are kids. The same thing can be said for people who are experiencing homelessness. They may be having other things that are going on that they didn't know to be more visible or not to step out in front of a car. But if we have, again, reduced speed limits or infrastructure in place, I really feel like we can reduce that. We're not an invisible state. We're number one in the nation for pedestrian deaths. I do sit on the NMDOT's pedestrian safety task force, and they are addressing that 2-year lag. So just so you know, that is being addressed from that. I'm out of time. I thank you for what you're doing.
Thanks, Ashley. Okay, so that concludes the presentation. Shoshana?
Yes, thank you.
Okay. All right, well, thank you. And is Trun still on? Thank you, Trun, if you're still there. And, all right.
Thank you.
Okay, thank you. All right, next we're going to go to the next item, which is going to be the Mobile Integrated Healthcare Team Introduction. And I see Paul Ford will be making the presentation. At least that's what it says. Where's Paul? Have you ever heard Paul sing? He's a pretty good singer, very good singer. I don't know why he's here. I think he'd be in New York, singing in an opera or something.
You'll have to excuse me while I find the presentation.
Seriously, he's good. You would think that he'd be like, I don't know, on Broadway. Paul Ford, yeah. We should do the EIL, what's that what it's called? For city staff, some city staff. EIL, isn't that like the basketball players? Oh, NIL, yeah, NIL.
Good afternoon, Mayor, City Council, Justin Allen, Deputy Chief of Administration for Las Cruces Fire Department. As Deputy Chief of Administration, I oversee our community risk reduction section and line of business, and within that we have the Project Light and MIH programs. So today is an introduction to our team. I'll be passing the microphone over to Battalion Chief Matthew Hiles, who is in charge of the programs.
Good afternoon, Mayor, Council members. My name is Matthew Hiles. I'm a newly promoted Battalion Chief. I just promoted to Battalion Chief December 2022, and I have been assigned Program Manager for the Mobile Integrated Health and Light programs. And I'm here to give you an update on where we are specifically with Light. So I'm going to go ahead and get into our presentation. So Light's going to serve individuals experiencing mental health crises. That's what we're there for. We're going to be part of the 911 system. LIGHT stands for to lessen the incidence of grief, harm, and trauma by providing a holistic co-response for those experiencing crisis within the 911 system, so they have received appropriate trauma-informed care in their time of need. Now, by holistic, we also mean we're going to have a social worker and a firefighter paramedic as a team. 2 teams of 2. One is going to have the firefighter paramedic, one's going to have a social worker. We're going to do a holistic overview by the social worker, which is going to include their environmental, social, mental health, and we can also give physical clearances by the paramedic on scene with them. This is going to be an expansion of the response we have for the 911 system for mental health services for those who are in crisis. And now we're going to go ahead and start introducing our team. On the left, you'll see Mindy Fowler, Karina Jimenez. They are Light Team 1. On the right there in this picture, you're going to see Michael Torres and Allison Stoner. They will be Light Team 2. As Deputy Chief Allen said, he's in charge of the line of business for community risk reduction, and he's been with the department since 2002. That is myself. I've been with the department since 2007, recently promoted to battalion chief again December 2022. This is Allison Stoner. She has a master's in social work, and she's been with the department since 2020. Mindy Fowler also has her master's degree in social work and has been with the department since 2021. Michael Torres has been with the department since 2016, has been a paramedic since 2019. Karina Jimenez, she's been with the department since 2017 and has also been a paramedic since 2019. This is Wes Smith. He is our case manager. He comes with a master's degree with public administration. He has joined us December 2022 and brings a wealth of knowledge and experience with him. And as you know, the Paul Ford, the man who needs no introduction, but here he is anyway. He is our MIH coordinator, firefighter, paramedic, and yes, he does have a bachelor's of music from the University of Hartford. So Mayor's correct, he is a good singer. He's been with LCFD for 13 years. This is Crystal Contreras. She has her master's of social work. She joined us December 2022, who also comes with a great deal of knowledge and experience. And then Lucio Avalos, he's been with us since 2011 and has been a paramedic since 2016. Elsa Apodaca, she's our assistant management specialist. She is from Mexico and has done a lot of work in political campaigns. She works with MIH, light, and fire prevention to collect our data. Okay. So what the light team will do, well, the light team will provide in-field de-escalation, okay? Part of the 911 system, not the 988 system, and I'll get into that a little bit. With the holistic assessment, which again goes back to the environmental, social, mental aspect, and physical aspect of that individual. We're gonna have trauma-informed interventions, transportation to definitive care with our community partners. It's not always gonna be a transportation just to the emergency department. That's not what they may need. They may need help from our other agencies, such as the Peak, Mesilla Valley Hospital, and Casa de Clinica. And we're also gonna have mediation and advocacy, on-scene medical assessment care, and clearance as appropriate. Crisis revolutions can include treating in place with trauma-informed interventions, providing psychoeducation on disorders and medications, education on and linkages with community resources, like I stated before, with the Peak or Mesilla Valley Hospital, and the emergency department if they need it. Transporting patients to the appropriate facility or resource, providing appropriate follow-up. So that way we know they continue to get the help that they truly need to help them through everything they're going through after the fact. As I said, we have the 2 light teams comprised of a firefighter, paramedic, and a social worker, and the benefits do include the holistic approach, broader scope of care, and in-field medical clearance. And with that in-field medical clearance, we're also complementing the paramedics with all the equipment they're going to need on hand to work within their complete scope of practice, still under the supervision and medical direction of Dr. Ben Diven as well. So what Light is not going to do, Light is not referral-based response. That is where MIH will come in. It's going to be two separate lines of business. A team that responds to 988 calls is not what we're going to be a part of. We are not part of 988. We are going to be part of 911, the emergency response system. I've already started working with MIRVDA and getting those recommendations worked on, and hopefully by the end of the week we can start making some dry runs and work out any kinks. And this is not structured for long-term case management. Again, this is part of the 911 system, and it's to help lessen what's going on at the moment, de-escalate. And it's not designed to operate outside of city limits. This is going to be strictly within the city limits. So here's some data that we got from 2022. And 1,070 LCPD behavioral health responses happened. In addition to that, PD had protective custody incidences of 649. LCFD went to 154 suicide attempts. LCFD went to 163 welfare checks and 542 overdoses, with a total of 2,578 calls alone just in this aspect. Fire department personnel identified an additional 280 calls as being attributed to mental behavioral health issues after arrival on scene. So as you can see, these numbers are big. So Light dispatch, again, only for 911. Right now, LCFD is not responding to behavioral issue problems or suicidal subjects, but Light will be going to these and be dispatched to those. The overdoses, a suicide attempt, and CPR in progress, the Light teams will be added in addition to what is already responding from LCFD and everything that is set up with that call matrix. So for an example, we already send to an overdose an engine, a transport unit, a PD unit. Well, then now you're going to see a Light unit with that. So the type of data we're going to be working on collecting when we get started is the number of calls, the available status, the day and time of our peak hours. If our peak hours are what we really believe they're going to be, or do we need to adjust and how? The disposition being the locations that we take them. Is it what community partners are we going to work with the most, or where's the benefit for that person going to be? And sometimes it might just be the emergency department, but it could be, again, some of our community partners. And how many times do we get refusals of service? Because as you know, if they are coherent and they can answer our A&O questions, they can refuse our service and we have to leave them be. The interventions, the de-escalation that our social workers could be putting forth, or is it a matter of clearing them medically, whether we have to provide treatment or really truly get them to the emergency department to provide that continuum of treatment. And again, just overall psychological aspect of everything that's going on with them. Trends, we hope to decrease the interagency co-response over time. So if we see a trend that, maybe we're not going to people as much as we are because we went to them 4 times one year, but the following year maybe twice, maybe the following year after that once, we see that trend that we want to see. In a sense, it's like, put us out of business, like we want to see people getting better. Hours of operation are going to be from Monday through Saturday, 8 a.m. to 7 p.m. So that's what we've identified so far as what are going to be potentially our peak hours for these types of calls. There's going to be shifts, and each team's going to work 3 12-hour days in a row. On their 4th day, they will have a 4-hour shift, which will be their administrative hours. That's where they can either get caught up on reports or any of the training or CEs that the social workers need to do. There's clinical supervision that they still need to complete and work on. There's a lot that they have to do. And then the oncoming shift will start their first day that week with 4 hours and then do the next day with 12 hours. So it's split Monday through Saturday. Then they switch. That way they can alternate weekends. So community partners. Relationships with community partners, facilities, agencies, and organizations are integral to this project by far. Without the cooperation of the CTC, PEAK, Mesilla Valley Hospital, including all 3 hospitals, being on the same page and understanding what we're there for and where they can fall in place with us and where we can fall in place with them is going to be huge. And to foster this positive relationship, the Light Team members we're going to conduct face-to-face meetings, which we started on. We've developed MOUs as appropriate, for example, with FYI Inc., who's going to be another huge community partner of ours. We gather admissions criteria for partners to aid in referring patients appropriately. So what could be canceling factors for that facility not to be able to accept a certain individual, but maybe this facility can, so it's just going to be knowing who to go to for what circumstance. And that's just going to happen throughout the process of just the next few months. So last year was a busy year in getting this started. We started the hiring process January of 2022, which was identifying the need, then starting to build on the job descriptions, the openings, and everything, plus posting everything, getting those that are interested and qualified, the interview process, and it took some time. So the hiring process took all year, and the onboarding started June 2022. Since November and a lot for December and January, we've been ordering and getting a lot of equipment and supplies ready to go for our launch date. And then we also recently got notified in January of our federal funding right at around $1 million from when Senator Lujan and Senator Hein came and presented, and that was very nice. We updated our FYI agreement. And the protocol and development consultation with FYI and Dr. Diven started in June, and we have pretty much concluded all of that part so far. So policies and protocols for us are almost concluded. January 16th through to February 27th, still just completing the equipment purchases, making sure everything's in order, and like I said before, working on the communications and training for dispatch from MRVDA and making sure we get our dry runs working out good and response ready. February 3rd through 20th, the finalization of protocols, and then just more internal team training, working on the scheduling, make sure that all works out great, and anything else that comes up that we just need to work on. February 3rd through March 3rd, we have stakeholder meetings. And this is kind of going back to what I was saying, getting with the PEAK, CTC, Mesilla Valley Hospital, the 3 hospitals, and having those meetings with them. We are going to have an open house March 2nd at Station 1 with those stakeholders as well. So that way we can have those face-to-face conversations, those impromptu questions that we maybe didn't think of that they need to that we need to consider. And then just to further explain our goal in detail and how we can work together as teams to make this program really take off and work. And then also disseminate the information with LCPD, because we will be working with them in the 911 system, and then as well as our own personnel and LCFD. And then March 6th is our goal to go live and have them implemented in the system. And that's all I have for now for your update, and I can stand for any questions.
Okay, Mayor Pro Tem and Councilor Graham.
Thank you, Mayor. Thank you, DC. I just want to stand up and jump for joy. This has been, a brainchild from mine for many, many years, and to have council that's prior and sitting here today, want the willingness to support. I just want you all to know how, man, I am so appreciative of what you're going to do and the kind of impact that you're going to make in our community for our citizenry. I just know it's going to be positive. It's not going to be easy. Just being a social worker and being out there in the field, I can only imagine. I've been there, done that, but I am just so thankful and grateful to each and every one of you. Please know if there's anything that I can do to help with anything, go through evil, but it's here. I'm so excited for you guys, really am. My question is around, and I wrote it down, let me see. the hours of operation and how you selected those. Can you tell me a little bit about that process?
So the hours of operation, we did do some data research on when the calls are being generated for behavioral or suicidal ideations or suicidal attempts, overdoses, and so that time frame really was just the bulk of it all, to start with that. And again, like if we need to adjust, we will adjust. But it was just a matter of pulling the data from past calls.
Okay. Some of the data that you shared with us specifically, and you might want to go back to the slide, the suicidal attempts, the protective custody. We've been talking to PD and Chief and the DCs about protective custodies and just the sheer numbers. There's just so much, right? And then hearing from them specifically, and you mentioned several times the emergency room, and something that I want us to move away from. Many of these cases are so not appropriate for the emergency room, but probably more appropriate for some of acute care, and acute care that we might not have in our community, or those that are suffering from fentanyl or opioid use and abuse. Have you had conversations specifically with the hospital and what that might look like, or are those the things that you're going to be doing here with your provider communication? I think that the open houses and such.
Yes, that is something we're currently working on and doing right now.
Okay.
Yes, we're still working on communicating with all of them.
Yeah, okay. I do want Mayor and Council to just know I've had deep concern about the 5th floor being closed and continue to be closed. I know that there've been some very limited communication with John about why that is, and I feel like they should have the 5th floor open, and they do not. And the excuse is there's not enough providers. There's a provider shortage. And although I think to some extent, as it relates to licensed social workers and counselors, and I guess now pediatricians can add that to the list. There are folks. I just think it's a big issue and something that we should really. If this is going to work, that 5th floor needs to be open. And I'm asking that we have some very serious conversations with John Harris and their board, and if we have to, the Tennessee boards very specifically, because this is outrageous that it has been closed for the amount of time that it has been. And I think there's political will on this council to put the pressure, and this is not a criticism on your all's part, but it's something that in order for the LIGHT project and MIH to work, that also needs to be working as well. And I haven't heard a good reason why, especially when I know there are specific entities that have no problems recruiting that level of expertise. So with that, I appreciate all of you. Thank you for being here. I know you're missing some of your group, I think, your team. I don't see Allison out there, and Ms. Contreras. But I appreciate you very much and very excited, and I look forward to hearing the positive stories that you have. We heard a little bit of that when Senator Heinrich and Lujan were here. You've talked a little bit about some of the stories that were positive, and so I just really looking forward to hearing more. Thank you, Mayor.
Thank you, Mayor Pro Tem. If I may, Councilor Cram, before I go to you to kind of address Mayor Pro Tem's comment, Ifo, you may want to just run this by John. So I was talking with the former psychiatrist who worked there, and I think a lot of it, I asked if it was obviously to bring in psychiatrists, it's going to be, can we match a lot of the pay that they get? And so I had asked him, what did he think if we, this county and the city, because they receive this, it's both our hospitals. Maybe help get that, take the current, let's say they're offering $250,000 for a psychiatrist, and if we were to, this county and the city kick in, I don't know, 25 or 50,000, but this would have to be ongoing for, but I know we can't really discuss that, but if you can let John know, that might be something there will help raise that level of compensation for psychiatrists, and we might be able to get them maybe at $350. So, Councilor Corral? Oh, I'm sorry. Councilor Graham, I'm sorry. And then Councilor Beta.
So many Beckys. Thank you, Mayor. Thank you so much for this. Thank you, team. As of this moment, are we completely staffed for both MIH and Project Light?
No, not right now. We still need a firefighter paramedic on the MIH side. But for Project Light, yes, we are.
Okay, so our only recruitment shortfall, how many firefighters do we need to recruit into MIH?
Just one.
Okay,
Yeah,
is that?
It's because a vacancy just barely was made.
Okay.
Aubrey Kraus recently just got a new position as assistant state fire marshal in Oregon. And so she moved on to great things over there, which vacated the current position.
Okay, and if there's anything, I don't know if you're anticipating recruitment challenges. If so, is there anything that we can do on our side to make that a little easier for you?
Currently, I think we will have it under control. We just need to fine-tune some things, I believe, but I think we'll have it.
Okay, great. The other aspect, I love how this is a model for trauma-informed care, and for obvious reasons, I also think a lot about the trauma and hardships that first responders see when they are, when they are doing these jobs. And I'm wondering, I would hope that this will also be a model, not just for trauma-informed care for our patients, but for trauma-informed work for our first responders. Mendy, you and I had a really great conversation about that when I came and did an MIH ride-along. Is that anything you can speak to on that side? How are you going to take care of each other in addition to taking care of our residents?
One more.
Deputy Chief Allen for the record. So we do have a peer support group that is in the department that we have been working on over the past few years, but it kind of fell out the wayside during COVID. We have stood that back up though with a pretty robust membership. We are currently seeking some training and have a training opportunity coming up April or May through the International Association of Firefighters are presenting a class here for peer support. On top of that, we are looking at sending several of the members to specific peer support training outside of the city limits.
Okay, great. Thank you so much. Thank you, Mayor.
Okay, Councilor Abeta, and then Councilor Bencomo.
Thank you, Mayor. And thank you, VC Hiles, and congratulations on your new position.
Thank you.
A couple of my questions are just based on the logistics of how we see these teams needing to grow later on. First, is there any sort of estimate that you all have about how long it might take for each call to be done? Because I know it can vary greatly, and so I'm sure that's probably one of the tracking items you're all going to have.
Yes, it is one of the tracking items we have. I don't have a number for you or a time frame for time on task, but that is something we will be looking at for sure.
Okay. And then as we go forward then, all that will be put together for us to say, if we were going to fully staff and fund this project, we would need X amount of teams. If you want to start making this, expanded service or 7-day-a-week service, then we'll perhaps have those estimates for us.
Yes, after talking with Chief Smith last week, we would like to come back in around the 6-month time frame to have some actual data for you that after a 6-month run and making those adjustments and making note of where we could get some help or make some changes, need some improvements.
Okay, thank you. And I appreciate that, you know, with the boon of the $1 million, I think is fantastic. But looking at like long-term sustainability for this program, whether it's internal type of items or if we're going to be dependent or reliant on other types of federal funds, I think it'll just be important for us to track and look what we need to advocate for at those different levels. And then just a thank you to everybody who's decided to be part of this new program. I know it's going to be hopefully very helpful for our community and not necessarily something that firefighters who were in this were here, 5-6 years ago, thought they would be doing. So I know that it's something very different. So thank you to everybody working on this program. And thank you, Mayor.
Thank you. Councilor Bencomo.
Thank you. Thank you so much, BC Hiles, and congratulations on your recent appointment.
Thank you.
And thanks to you all again for being here. It's been nice to hang out with you the last month a couple times. I'm certain it's the least favorite thing for you to do, to come to these very long meetings and hang out with politicians, but I really appreciate it, and I think it's a great opportunity for us to lift you up and to highlight the incredible work that you all are doing, so I appreciate it. It's my understanding, I think most of my questions I will hold off because they're really around like 911 related, and it's my understanding that that's coming, right, the MRVDA work session? I think so. I think there was, last time I brought this up, Chief Smith said that they were working on a work session with MRVDA to sort of better understand their training side of things, how they're transitioning. So I'll leave those questions to then, but just heads up for that. I'm excited about this 6-month plan. I think that's really, really great and important, especially as we think about funding and the needs for you all. My other question, though, and it wouldn't be immediate because I'm assuming you had conversations, but I'd be really interested to understand how Project Light could additionally include domestic violence calls. And I know that there's a ton of PD protocols in terms of domestic violence, so I'm not suggesting taking that completely away, but I do wonder if there's a space for this kind of team to also respond to those kinds of calls.
So I feel like I could probably give you a better answer after around the 6-month mark, and see how all that goes. To say whether yes or no, I think would be premature.
Yeah, absolutely. I just wanted to raise that today as something that I would like to see if there's space for that. I obviously don't want to say do it now because I'm excited, period, that this is happening, and I think it's going to save lives as it is. And so that was really my only question. I'm really looking forward to that conversation with MRVDA about the integration of 911 and how this is all going to work. But just wanted to say thank you again.
Thank you.
Okay. Councilor Flores.
Thank you, Mayor, and thank you so much for your presentation, and thank you all. And I do have a request. I wish that Paul Ford would sing our, not today, but the Star Spangled Banner one of these days, maybe on July 4 or something, or right around there, maybe. Anyway, but I do want to thank you for this, and I know that you presented to our Health Policy Review Committee some time ago. It was when right after the social workers were hired. So it's really wonderful to see that it's been implemented and that you're getting on. The only question I have, or concern, is that I know that MRVDA is going to be critical in terms of, I guess, the 988 calls and the 911 calls will be going. So staff there are going to have to be fully trained to distinguish whether, which entity goes out. And I think that, I think domestic violence probably would maybe go to LCPD because it's, the crimes are being, allegations of a crime going on, perhaps, I don't know. But that's sort of the fine line. I think that's a real fine line call for a MRVDA operator. So that's the only concern I have insofar as the training and then going out to the right entity. But again, thank you so much for all your work, and Nice to see you, social worker, and all of you. Thank you so much. Thank you, Mayor.
Okay, no one else? Well, I want to just echo all the sentiments that were said here today, and I want to appreciate my colleagues, Mayor Pro Tem and Councilman Como, and all those that were involved in this. This is really forward-thinking, and I know some larger cities more than us have this or are beginning to do this, and I think this is trailblazing efforts on behalf of the city as well as the fire department, and I think it's going to work out quite well, extremely well. So let us know whatever items or things you might need to make this more successful, and good luck. Okay. That was into your presentation?
Yes, sir, and if I could just say one more thing, I do want to say I'm very proud of this team. They're a very strong team. They've come together like a family, and that's what's going to make this project really great. So thank you for recognizing that, and they put in a lot of hard work. So
fantastic. Thank you again.
Thank you.
Okay, if there's nothing further, entertain a motion to adjourn.
Move to adjourn.
Second.
Motion made by Councilor Bencomo, second by Councilor Graham. Christine, that we adjourn.
This is on the motion to adjourn the work session. Councilor Beta?
Yes.
Councilor Graham?
Yes.
Councilor Bencomo?
Yes.
Councilor Coran?
Yes.
Councilor Flores?
Yes.
Councilor Gondeta?
Yes.
Mayor?
Yes. Okay, we're adjourned. It's 3:14 p.m. Thanks. Okay, this is the agenda setting meeting for our February 21st, 2023 City Council meeting. Number 1, consent.
1 consent.
2, non-consent.
2 non-consent.
3, non-consent.
3 non-consent.
4, non-consent.
4 non-consent.
5, consent.
5 consent.
6, non-consent.
6
And
non-consent.
I'd like to add item number 7, which is to authorize city manager to sign documents needed to receive funds due to the city of Las Cruces resulting from the class action opioid drug settlement, and that'll be consent.
Okay, 7 consent.
And then number 8 will be authorize the city of Las Cruces to develop a team to discuss opportunities of additional funding owed to the state of New Mexico resulting from the class action opioid drug settlement, and that also consent.
Okay, and 8 will be consent.